Hey everyone, Kevin from Rad Roller here. I'm joined by Kim, and in this segment we're going to show you how to use the Rad Rounds. Alright, so now we're talking about targeted release for those hard to reach places. We have two different sizes. Green is a little larger, blue is a little smaller, and the blue is a slightly more dense. Alright, so a little more of a firm release. This is great for all those tiny spots in the body you can't quite hit with a product like the Helix. We're going to show you 4 different examples of how we can use this on the body. We're going to show you something for the front portion of the shoulder, the pecs, the back portion of the shoulder, the external rotators, the hip flexors, and then lastly we'll show you how to roll the arches of your feet. Okay, so Kim, let's start by demonstrating the pec release. Now, you're going to want to find a bar in a facility, or even a door frame at home would work quite nicely. All right, so let's walk this way. So let's target the left shoulder. You want to assume sort of a lunge stance, so kind of split your legs. Perfect. So you're comfortable, you're stable. Let's move the arm up to about a 90-degree angle at the elbow. Now we want to go just below the collarbone. A muscle called the pec minor runs vertically like this and often gets really tight and short, and is quite painful and tender when you do this release. So a few different techniques we can execute. You're going to just find a tender spot, treat what you find. You're going to move around and find the spot that's most tender. Once you find that, sort of lunge and press into the Rad Round, and then count for 10 deep breaths. All right? Next, we can add some tiny micro movements or parameters, and you can sort of go up and down a little bit. We can also try going side to side. Do whatever feels best. And lastly, we'll try another technique where you're going to lengthen your arm, reach with those fingertips, and then you're going to sort of rotate your body to create a shearing effect. Good. All right, so now let's show the other side of the shoulder. Kim, I'll get you to line the floor here, please. There we are. So make sure you're comfortable. You can even kind of rest your head on your hand if you want to prop yourself up, whatever feels best. Now we're going to find that spot right in the back pocket of the shoulder. We have a group of muscles here called the external rotators, and you're going to again search for any tender spots. When you find a spot that's quite sore and painful, you're just going to sink in, relax into the release. Count to 10 deep breaths. Next, we can add some movement to that, so you can sort of shift up and down, or even side to side. Great, and lastly, I'll get you to extend that right arm, reach those fingertips for the wall. This one here. There you go. Lengthen the arm, reach those fingertips. We're lengthening these structures that we're targeting. And again, shear across. Great. Now, Kim, I'm going to get you to shift downward toward the front of your pelvis into the hip flexors, okay? So we're going to find this pocket of muscles where we find the TFL, we find the rec fem, which is part of the quadriceps. We're even going to get the outside of the IT band up near the top portion of that muscle. So make sure you're comfortable, your body is supported. You're just going to find a spot that feels tender and restricted. Sink in and hold, count to 10 deep breaths. Now we can add some movement. You can sort of shift up and down or side to side. Excellent. And lastly, you're going to lengthen the leg, point your toes downward, and then sort of shear your body across. Good. Whichever feels most effective, spend the most time doing that technique. And lastly, we're going to utilize the smaller Rad Round, and we're going to target the arches of the feet. All right, so I'm going to ask you to stand up, and I'll get you to take both your shoes off, please. Now, you can absolutely do this product to skin contact, totally by preference. You can have a sock on as well, okay? So Kim, I'll get you to stand. You want to make sure you're balanced and just sort of relax your foot, let those toes drop. We're hitting the plantar fascia on the bottom of the foot. We have three main arches. We have the lateral, we have the medial, and we have the transverse arch. So pretty much you can try to cover the entire surface area of the bottom of the foot. See what you find. When you find a spot that's quite tender, pause, kind of press your weight downward a little bit more, and wait for 10 deep breaths. Again, we can add some movement, so you can sort of shift front to back or side to side. And then we can also try moving the toes, so almost sort of grab the ball, sink your toes down, and then almost extend those toes up and lift. And do that repeatedly.